Hello, my name is Dr. Brett Welch. I will be discussing age-related macular degeneration. What age group is affected, and what race is most affected by the malady? What makes you more at risk? How many types of AMD are there? What are the 3 stages of dry macula? How can you prevent vision loss? What treatments are available? The objectives are to become familiarized with the different types of age-related macular degeneration, be able to distinguish between the 3 stages of age-related macular degeneration, be able to understand how DNA plays a role in age-related macular degeneration, be able to understand how to prevent vision loss, and be able to understand what treatments are available for age-related macular degeneration. There are multiple factors that contribute to age-related macular degeneration: diet, environment, and genetics. Macular degeneration is the leading cause of vision loss in Americans 60 and over. People who smoke have a higher risk of developing hypertension, which leads to the shrinking and narrowing of the blood vessels in the choroid, which permits blood and oxygen flow to get to the retina. People who are overweight, particularly men, and have a high consumption of cholesterol and saturated fats are at a higher risk of developing AMD. Family history plays a major role in AMD. Studies show that AMD is caused by mutation in the complement system protein factor H, which reduces the ability of factor H to recognize certain glycosaminoglycans, reducing the capability of CFH to monitor surface membranes in the back of the eye, which causes inflammation within the macula. Glycosaminoglycans are any of the carbohydrates containing amino sugars that occur in proteoglycans, hyaluronic acid, or chondroitin sulfate. Proteoglycans are found in pork, beef, chicken, lentils, eggs, asparagus, chickpeas, cheese, and cabbage. Chondroitin is found in bone broth. Hyaluronic acid is found in bone broth, leafy greens, soy products, root vegetables, and citrus fruit. The C3 gene is responsible for making the protein complement component 3. This protein is a group of proteins that fight bacteria and viruses that cause inflammation and eradicates debris from cells and tissues. Changes in this gene increase the risk for AMD. Distorted forms of the complement factor B have been found in many AMD patients. It is a single-chain polypeptide that circulates in the blood. This group of genes regulates the immune system. Race plays a major role in AMD. White people are twice as likely to suffer from loss of vision and become legally blind from AMD than African Americans or Hispanics. Hispanics are only 0.5% affected by AMD. African Americans have less than 0.5%, while 10% of the white European descent population between 60 to 80 has AMD. People of white or European descent are at higher risk of developing choroidal neovascularization and geographic atrophy than Hispanic and African American people, due to DNA mutations. Studies show that nearly 50% of Hispanic Latino individuals in the United States who have diabetes have some form of diabetic retinopathy. Diabetes reduces the level of glycosaminoglycan in the glomerular basement membrane, which can reduce the ability of factor H to recognize glycosaminoglycan, which can lead to the development of AMD. Glycosaminoglycan found in CFH is greatly affected by diabetes, especially the heparan sulfate component of glomerular basement membranes of the kidneys. In 2011, Vanderbilt University Medical Center, located in Nashville, Tennessee, argued that only Caucasian DNA has been studied for the treatment of AMD and that AMD begins and progresses differently in African American DNA. The initial information indicates that the genetic risk factors act in a different way in African Americans than in Caucasian. This is a significant breakthrough in creating and employing predictive risk models. This study group helped in the understanding of the core process of this disease, and this will allow the development of effective treatments for the prevention of AMD for all individuals. There are 2 types of AMD, dry and wet. Approximately 90% have the dry type and the remaining 10% have the wet type. Wet AMD occurs when abnormal, fragile blood vessels behind the retina begin to grow under the macula. The blood vessels often leak blood and fluid, causing the macula to shift from its normal location and potentially damaging it rapidly. Wet macular degeneration is more severe than dry macular degeneration and can lead to vision loss more quickly. Regular comprehensive dilated eye exams can diagnose macular degeneration in the early stages in order to prevent vision loss. The treatment for wet AMD is anti-VEGF intravitreal injections for blood vessel reduction. Dry macular degeneration has 3 stages. It can occur in one or both eyes. Early, the light-sensitive cells in the macula gradually break down, slowly obscuring central vision in the affected eye. You could have problems recognizing faces and notice that you need more light for doing normal tasks than you did before. An early onset indicator is a straight line that appears wavy. Yellow deposits under the retina, known as drusen, are an early indicator for AMD, which is usually detected during a routine dilated eye exam. At the intermediate stage, you may notice blurred areas in the center of your vision. Lastly, at the advanced stage, macular function is lost, leading to central vision loss and potentially blindness. This is what yellow deposits under the retina, known as drusen, look like. Dry macular degeneration typically affects both eyes. In some people, it affects only one eye, while the other appears unaffected. Women appear to be at greater risk than men, because women tend to live longer than men. It is age-related, and it occurs most often between the ages of 60 and 80. There is no treatment for dry AMD right now, but there is some evidence that high doses of vitamin A, C, E, and the minerals zinc and copper when taken together can slow the development of dry AMD. There are products on the market intended to help with the symptoms of AMD. A balanced diet of fresh fruit and green leafy vegetables is recommended for eye health. To recap, in this lesson, I discussed the different types of age-related macular degeneration and how to distinguish between the 3 stages of AMD. Lastly, I discussed how to prevent vision loss and what treatments are available for age-related macular degeneration. Thank you for joining me today. Again, my name is Dr. Brett Welch. This concludes the lecture on age-related macular degeneration. Enjoy the rest of your day.